I I was mentioning that there are a few people who couldn't be here today. Dr. Carlbom is teaching. Chief Manley is, I think, out on break, and I think those are the folks who are missing. I can see that Laurie Tinker is trying to connect, but not able to, because it's probably been a good 5 minutes that Tim McKern and I have been on, and it hasn't cleared yet. So I wanted to sort of, in the order of folks who will have to peel off quickly, Chief McKern, I know there seems to be a lot going on with you and Commissioner Brotherton. If there are any updates either of you would like to give, or questions you would like to ask, resources. When I looked at the list of things that we were going to do actions on, I'm looking at slide 3. Let me just share my screen really quickly. Can you folks see that? Okay, now I can see you both. There was some discussion around moving the emergency gathering place generator discussion forward, and I think that had to do with Brennan. And it seemed like from the notes that was something.
Speak to that real quick.
Yeah, that'd be great.
Sure. Trish was at the meeting, as well as Chief Manley and Willie Bentz from the Department of Emergency Management. I think the fire department in Brennan is going ahead to get bids for an emergency generator. I think the consensus was that the fire station will work great as a gathering place, warming center, in case we have another weather event like before, like this past year. And the school district would work really great as a supplement to that, since they have, school kitchen facilities, and they are directly adjacent to the fire station, basically. So we're going to reconvene in June because of the weather event and the declared emergency that it was. There are actual dollars expended during the emergency that can be reimbursed through FEMA right now, but there's an after action grant opportunities that come up within a few months, but it's kind of whenever FEMA gets to it, according to Willie. And Trish, correct me if I mischaracterize anything. There might be future mitigation grant funds based on that emergency. So we're going to reconvene in June. And by that time, the Brennan Fire Department will have a good backup generator, propane backup generator bid. And we'll see if we can't supplement that, the cost with FEMA grant. And that's where we are. So reconvening in June.
Okay, good to know. Thanks. Anything else to add or ask on that topic? Okay, moving right along then. I know I haven't had everybody introduce themselves, but you all know each other. Jim Novelli just came in. You folks all know who he is. Oh, come on, Jim. Okay, just say who you are and where you're from. Everybody else knows everybody.
Jim Novelli from Discovery Behavioral Healthcare.
Good to have you here.
What's his name? What's his name?
I think he said Jack.
Oh, hi, Jim. Welcome to the group.
Thank you, Tim.
Moving on to the lock zone supply for the sheriffs. Is there any update on that? Questions, support we can give?
No update. The idea I had of funding it through CJTA kind of fell through. And
Okay, well, that's good to know.
but I did get a contact. I just haven't had time yet with the state, but I'm thinking it may not be what I was hoping, but that won't be a detriment to us getting it. I mean, if we could find someone else to pay for it, that'd be great, but we'll still have it.
When we power through these few items, I wanted to show you just a rough cut of an overview of a grant we're thinking about going after. And there's a rough cut of a couple of options of how that money might get distributed. And maybe there's something in there, Joe, that we can think about. Jim, did you want to talk at all about the vending machine harm reduction?
Yes, I can give a little update on that. I know Denise Banker and myself met with online with Thea Oliphant Wells from King County, who is getting ready to distribute some machines in that county. I think they have 2 or 3 machines, if I remember 2, I think. And the process of what it took to get those machines and what they're capable of doing and how they plan on using them. I just got off a meeting with the Public Health Vending Roundtable, which actually was, I don't know if Denise, you were able to get on that. And this one was all across the country, East Coast, Midwest, and West Coast, different different states talking about their vending machines for harm reduction. And that's what they really call them, for harm, because they have many different items in them besides just naloxone. They do
Mhm.
needle exchange in them, fentanyl test strips, condoms, things like that. So it's an interesting package deal. The price ranges for these machines seem to be all over the place. Some of them are very pricey. But this is a big deal. A lot of these counties are putting, a lot of these states are doing 20 and 30 machines at a time and distributing them in different areas. So I think, so looking at this as a potential for this area, I think getting 2 machines, one in South County, one up here in the North End. The way you get access to these machines, people get a code, like a 123 code or something like that to get access, to get in there. And it's keeping them stocked, and you want to have as much access to the machine as possible. So, question of where to locate them. They do make outside machines that you can actually purchase, and you have to encase them in something, because in our luck, people like to destroy vending machines. We know how that goes. I just concerned about, but there's a lot more to learn about this. And I think it has some very strong possibilities to find some funding for these machines. For instance, the ones in King County, she got a deal because the company made these machines for something else and the people didn't need them. So they repurposed them, and she got both machines for $7,000, which, listening to the prices on this public health, they're paying a lot more for some of those machines. And so this is exploding all across the countryside, using these vending machines for harm reduction. So people have easier access to naloxone. So I think this is something our county should consider. Good.
Yeah, sorry I wasn't able to make that meeting. I'm kind of doing a 3 things at once today. But I was wondering, did any of them mention safe smoking supplies in any of those?
I didn't hear that in any of those, but doesn't mean they haven't put those things in there. I mean, they're making these little packages of multiple things in them and putting them in those slots. So it's how you design the machine, because you can design the machine to fit bigger items, smaller items, and things like that.
Right. And then when we met with Tia, she did say that they have them in the foyers of a couple of places where you just briefly interact with someone there who then gives you the code to use it. Because I know one of our concerns was, if we just have a machine, what's going to keep somebody from emptying it out or ruining it. And then they did address that they put the outside ones are in cages so that they can't get.
Right. And if you use a code, from what I understand on the machines, it only dispenses one item. You can't reuse it. Once the code is used, that's it. So you can't really empty a machine out, from what it sounds like from these other people. So, and what they do is they see people call in maybe and get a code if they need it, so they don't have to actually interact with somebody. So there's lots of different ways, I think, of handling this. And I just sat and listened to this group, but I didn't ask any questions at this point, but they were reporting on their progress and how things were going. So I think this will be a good group to kind of keep attending.
Sheriff,
I think it's exciting.
question?
I had a question. Oh, sorry, I had a question real quick. I was just wondering, is there a street value for naloxone? I mean, I understand that there's always mischief happens, but I mean, is that a high risk that people take these and then find some way to move them?
As far as I know, I know people will take anything they think that might give them a high, but actually naloxone tends to ruin your high when you take it. So it really doesn't have, I don't believe, a street value at all. I mean, there's no harm with this stuff. So.
Yeah, and I haven't heard that, which doesn't mean that isn't the case, but I know that deputies have stopped cars or houses when they do search warrants, and they may have a supply of naloxone in there, which at first it was like, look at that, they got naloxone in their car. But then we got more used to that. So, and beyond that, but I guess it seems weird to me, I guess my concept of this whole thing, having the code, I mean, I guess I'm thinking, just to think out loud right now, is that what's the purpose then? They could go to the health department, get naloxone. So, I mean, I guess I thought it was going to be that I don't know, I pictured the machine down in Quilcene the post office and someone's having an overdose and you send someone to run over there and get it in a naloxone and bring it back.
And you could
But that
do,
doesn't- it's not going to be like that as such. It doesn't sound like.
well, I'm not sure because this is all digital. And so, you know, it's computerized. So you might be able to get
So they might be
online
able to
and
do it by
access the
phone.
code. Yeah, yeah.
With a text message or something.
Right. There may be a way.
Set
of
up a QR code. that-
Right.
Mhm.
Yeah, you might have a QR code on the machine. You hold your phone up to it and it shoots your code. So.
What's a QR code? No, I'm just kidding. I know what that is. But yeah, I guess, yeah, a whole new, yeah, I forgot there's all kinds of new ways to get into stuff now.
Yeah.
Do that kind of thing. Yeah.
So
And to your point, Joe, of coming to the health department, we met with the syringe exchange program team and have come up with a plan to train our front hub and our practitioners in the distribution of naloxone so that anyone who walks through the doors can get it at any time and won't be turned away. So we address that problem. And that hasn't taken off yet. We haven't implemented it yet, but we're
Yeah.
taking the steps toward it. Yeah.
Well, it makes me think like if the machine was located at the health department, then it would be for after hours, if nothing else.
Yeah, and I don't think that there's much support for having a machine located here. And because we really think that the problem is getting access in South County type places, in remote places. And that was one of the things we talked about in terms of, having more access here. That's one thing, but if someone can't get themselves here, then that's still the big barrier. And we also kind of talked about having one, at DBH, and that was the same thing. Well, yeah, it could be there, but then there's still the access issue because the issue down in South County is transportation. It's getting somewhere.
Mhm.
And so that was what came up in those conversations.
So at our last meeting, Chief Manley had noted that he thought that maybe the community center in Brennan would be a possible place to explore. I don't think anybody's committing to anything, but when we talked about possibilities, and I think in that case, it's a machine with naloxone. There's not a lot of other stuff in it. And the
I
other
think the
thing,
sheriff's office would be great too, wouldn't it?
he noted the
Like, that's
sheriff's
one that-
office. I'm looking at the notes, the sheriff's office, and he also suggested the ferry terminal in Port Townsend.
Yeah, I guess the only thing with the sheriff's office, I don't know if people would be reluctant to come here. Deputies are hiding in the bushes, ready to arrest them when they come up to get their naloxone.
I was thinking the fire stations might be I don't know, Chief McKern, what do you think? You staff 24 hours in a couple of them, right?
Here in Coolstein, that's probably the smart avenue, because I can tell you now, we are so close to the hub of everything. The school doesn't even call 911, they just run down the street. And we use to see kids running down the street to get us to go back to the school. So that's a pretty common. I was going to suggest, you're right, when you say the post office, because that's right next to the Southtown. If we were going to if the hours on the clinic were going to be more, it could be focused out of the clinic. But right now the clinic has not been, it's just staffed on Monday, Wednesdays, and that's about it. And so that's a different. So the answer to your question is yes, but we don't want to set the wrong tone.
Right.
Certainly now I'm going to put a sheriff here because people are going to be breaking into those things and trying to get done. Then, as Chief Manley said, we probably, if there's a place in Coolstein where it needs to be, it probably is the community center. Wednesday, it's a hot button for things going on, especially for the food bank and everything else. Everybody's coming, and so everybody knows about that particular area, and so that might be the answer. Put it there at the main bank. The only problem you're going to have is that we do have right next to it is I won't call it a homeless camp, but it's basically a place to stop for overnight camping, and And there are people.
That's a
saying,
county park. That's a county park.
Oh, it's a county park, okay.
Don't be dissing it.
Yeah, sorry. Excuse me, sir. County park. So we support wherever the sheriff wants to put it, as long as he's gonna support making sure he can keep an eye on it.
I did mention it to Mike Glenn. It's a hospital, and I can't, by no means did he jump up and down and say, ooh, I want one. But it was interesting, even though it's North County, not South County. I just keep tabs on the fact that this is sort of the new trend, the new thing. This is where lots of people are going towards. I think that's something I'll keep tracking, because that would be of an appeal to him, to be sort of out front and doing something that other people are doing, other hospitals, other small communities, that type of thing. So I'll keep tracking that for the hospital environs.
So like I said, Wenatchee's got one now, and OMAC, where I came from prior to here, the FQHC there is actually putting one in their lobby. I don't know what in the next couple of months. So, and I know the CEO there really well, so I might be able to reach out to him and see about that process and how that's worked for him. And that's a small community, so a very small community. So
yeah.
And I wouldn't be adverse to having one out here, but I just don't know if people would want to come here.
right.
The other thing I was wondering, in the meeting you attended, Jim, did they talk about like the community freaking out? And
There was some programs that the way they kind of get this put out there into the community, because there are a lot of people that have said, we don't want this in our neighborhood. We don't want this here. So, I mean, and I don't think it's going to be like in somebody's backyard kind of thing. I think if you put it in a business district or something like that, or, access, I think that would probably work, that, it's not in anybody's community per se. I mean, there is a group that believe this helps to enable people to use drugs. Like, oh, I'm going to go do opiates now because I have naloxone. But I think that's far and few between. I think this is the better choice than people dying from an overdose. And this is a good choice for some parents that struggle, that have a son or a daughter that is addicted or has addiction issues, that they can have this on hand or get access to this and have it. Obviously there is the abstinence model in substance use disorder services. And now this harm reduction is a little different. And, I talked about this with our newly acquired substance use people, and they had some really serious questions about naloxone and its access to it. But I talked to, actually I had a discussion with Ford this morning, and, he saw the benefit way outweighs anything. And it says better than people dying, is how we put it. So, yeah, I think the community would just be an education process that,
I think having it available for the family of folks in a place where they can just get it and it isn't a McGilla to get it, I think might be a really good thing.
Especially if we're talking about
I think ultimately down the road, that is one more chit to consider. One of the several machines that we'll be getting, I'm sure, to be hospital-based or, out in the parking lot, because although the hospital is in the community and of the community, I think being able to sell it as safety, health issues, and having this there, I don't think there'd be the community blowback about having a machine like that, to the side of the emergency room door or at the entrance of the emergency room, something like that. So, as I said, I'll just keep tabs on it.
Yep.
So you'll notice in the package on that slide that I was just showing you, there is a link to slides from a seminar that I went to, and at the end of it is a budget. So it listed out a pretty specific budget. I think we should keep in mind that was a more urban area, but if anybody wants to just have some general idea of what the pros and the cons, the challenges, it was a really good presentation, and I linked us to that on slide 3 there of your packages.
So just one other thing, that I know Denise saw the pictures of these machines. Seattle was really, King County, because they have all these really kind of decorated, really nice, they don't look like a bland soda machine or anything. They got all these artwork all over them that really appeals to that population or that age group potentially. And Yeah, they were really proud of the artwork on the machines. It was kind of interesting. I should get some pictures so we could share the next time.
Yeah,
That's a
they
great
were
idea.
super excited and
Yeah.
really, really proud of their machines
Yeah.
and really proud of the program that they got. It's just lifted. It's just taken off. Yeah.
Anything else on that topic? I'm going to slide on then to, there was something that we talked about last time, the possibility of talking about the rural challenges of these
One more thing from
Oh.
Joe.
Sheriff's
Sorry.
not done yet.
Yeah,
Sorry.
I'm sorry. I was getting carried away thinking about the machine. So what's next with the machine then? Machines, is it still just something that's, I mean, there's no machines are ordered, or is still just being looked into?
Right.
Right. Yeah.
I think there's a looking into it. There's a figuring out, location, budget, process to educate community beforehand and then during hand and then
Who's
after
gonna-
hand.
Who's going to monitor the machines? Who's
Who's
going to
gonna
keep them
monitor it?
filled within a lock zone? Who's going to be able to, if they break down, all that kind of stuff, maintenance.
Mhm. There's some things to be sorted out. It does fit in though with sort of the grant conversation that we'll get to here at the end of this conversation. But Laurie, at our last meeting, we talked a little bit about the challenges of site transport and maybe bring a more rural perspective to the legislature. And that was something that you mentioned maybe would get explored at the EMS Council. Do you know if it did? Or is there anything from the EMS Council you'd like us to know about?
I know it did not get explored. We had invited Joey Rodriguez, who is the gentleman who's the regional director of Olympic Ambulance. And just like East Jeff and everyone, they were in such a staffing crunch at the time of his scheduled presentation. He was doing a critical transport of a intubated pediatric patient. So nonetheless, so obviously we gave him all good graces to continue that. So I don't know. And I don't have any further information. The next EMS meeting is Monday, which is my travel day back from the East Coast. I'm in Washington, D.C. right now. And Chief Manley will be leading that. And I will talk to him to see whether or not there'll be an opportunity to have Joey present at that meeting and get back to you.
Okay.
So I
great.
really have nothing new to report on that front.
Okay. And nothing from the EMS Council that's worth bringing up here or sharing here? No. I know without Dr. Carlbom, we have no.
Yeah, nothing comes to mind.
Okay.
Can you think of anything? Nothing comes to mind from the last EMS council meeting, so I
Okay.
don't think so.
Good enough. I noticed public health dropped off, so I don't know that we can talk that much about literature that could go into the discharge packets at Jefferson Healthcare, but I know that was a discussion at our last meeting. I can tell you that, go ahead, Laurie.
Oh gosh, can you actually see me? I'm sitting in my son's garden shed. And I had thought, I thought I was going to have internet out here and with my laptop, but for some reason I don't. So I'm on my cell phone. I apologize. And what did you just say? There's something.
I was thinking about, I was mentioning public health had dropped off, and one of the things that they might have been able to talk with us about is that public health literature that could go into discharge.
Oh, yes. And I apologize. We have a 2-day-old that I've been dealing with here. So a little foggy around the edges. And I did get literature. I was at that meeting. I think Denise and I were both gobsmacked that we were in a meeting that Kent Smith did not know that there was a needle exchange program. And after the meeting, I queried him, I queried another ED doc, and I queried the hospitalist. And none of them knew that there was, or if they'd known at some point, they had forgotten. So they all know now, and they know specifically from my mouth to their ear, and with flyers from public health. And Dr. Smith is going to put a word text into the discharge checkoff list from the ED for the physician that, you know, this, and oh yeah, this too, for anyone. And the hospitalists will be doing the same. So one small follow through there at least.
Great. Well, thank you for that update. On the yellow cards, I wanted to alert you, we've got a new one being printed right now that will get out to folks. We've got a little date, I think, on the bottom, so you'll know it's the newest. There's several numbers added, and there's one, there was one number that was wrong on it. I think it was it was the suicide hotline. And so we wanted to make sure to get new cards with the right numbers on them. And we've added some numbers to that as well. So as soon as that comes in, I'll be pushing some down to South County, and just giving you that heads up that if we could pull the other ones wherever you've got a stack of them, don't use them, we'll give you new ones. I guess quickly then, we're at 129. Were there any other topics before I hop quickly onto this potential grant overview? Okay, I'm going to share my screen. Notice how I give nobody really time to say they want to talk about something else. There is a new grant that is coming up. Let me just, it's an RCORE grant, a HRSA behavioral health care support grant. And the highlight of it, I just want to pull it up quickly so that you guys can see. Thank you for your patience. So this is an opportunity that would start in 2022, September of 2022, and go through until August of 2026. There's 26 of these grants being given out because we already have what's called an implementation grant. And we've done well with the stewardship of those funds. They've come back and invited us to apply for that grant, this new grant. So the current grant that we have currently will end in August of 2023. So we still got another 18 months or so to go on that. So there would be an overlap of a year. And this grant is worth more. Our current grant is $1 million for the 3 years that we had. So that was about $333,000 each year. This one is up to $500,000. So when I think about strategy, I wanted to show you two things that we're thinking about. One is I should explain that while the grant that we have currently, you can go after the exact same grant again, $1 million over 3 years. And it would start in September of 2023 when the other one ends, and go through for 3 years until whatever that is, 2026, no, 2025. Anyways, we'd be 1 year shorter with the grant. And that, yeah, let me think about that. So with this potential grant, that's the $500,000 over a period of 4 years. I just did a rough cut, took off salaries, fringes, travel, training, supplies, everything that are sort of the baked in costs of a grant when you go after it, and looked at what we would have left over if I just tried to carry on the programs that we have currently, or that we hope to be using funding for. For instance, if this gets used for naloxone supplies, vending machines, whatever we come up with there. These things are already underway under our current grant, and this would just be extending them in the last 3 years if we were to get this $500,000 grant. And then one thing that gets added is I've been talking with Scott Mock, and they'd like to do an internal behavioral health services audit across the 4 school districts, and then look at where there's coherence and incoherence and come up with a plan of how to address that. And secondly, funding for a school liaison interventionist, which I've just guesstimated what kind of funding that would look like. So that gives you a sense of what that kind of budget would look like. If we went after and actually got the R-Core implementation, the same grant that we've got now, just went after it again, and also went after this $500,000 grant, there would be some available funds that we could use towards something. And so the reason why I'm even putting this out here in the discussion is I would like some feedback if there are any projects, positions, things that we can say support behavioral health services. It's a pretty broad description in the overview of what they'll cover. I'm just pulling it up here quickly. Yes. Thank you for your patience. This is the notice of funding opportunity, and specifically what they're looking for. They have these three basic things. They want us to address structural and systemic barriers to improve rural residents' access, improve quality and sustainability, and improve the capacity of the system to address rural community risk factors and social determinants. And it's that social determinants that makes me think there's a pretty broad range of what we could possibly fund with this funding. And so I'm putting it out there in folks' heads. If there are thoughts that occur to you, I welcome you reaching back and connecting in with ideas, things you'd like us to explore. This grant is due, the application is due April 19th. So I'm sort of running around trying to come up with what the strategy is behind a work plan that we would develop. And I want to make sure that South County is included in whatever we come up with, if there's something you'd like to have us chase funding for. Are there any questions on that? Thoughts? All right then. Any other questions before I let you guys go? Sheriff Nole?
Yeah, I guess just I was kind of confused when you were showing the budget. And it was for, I thought the grant was for 500,000, but then there was way more than that included in the budget. I just, are you talking about combining that 500,000 with money that's already there, or?
So are you looking at this? It's 500,000 a year.
Oh, okay, never mind.
Does that help? Does that make sense?
Yeah.
Okay. Yes, so this new grant would be 500,000 a year, whereas the one we have now is half that.
Well, that's what I thought. You said this one was more, and I was trying to figure, how could it be more if it's 500,000? But yeah, okay.
So there's advantages to going after it, ensuring the programs that we've got for 4 years instead of 3, and being able to add in that component of the schools, which we really haven't done anything. And I love the idea of the schools having control of their own thing, you know, not having people tell them what they want to give them, but having them decide what they need and letting them use it to the best use they can see. Any other questions? Okay, that's all I've got. Hope you guys have a great afternoon. Thank you for coming. See you next time.
Thanks a lot, Laurie.
Okay, bye-bye.